Hi, my name is Shawn Moniz, and I'm the CEO of Cannabis MedTech. We're trading on the Canadian Securities Exchange under MTEC stock symbol. I've been in this industry for about 15 years, in the last couple years in pharma and healthcare. And what we try to do is bring a little bit of that personal patient touch into the cannabis space, building the multiple platforms that we have at Cannabis MedTech. So Cannabis MedTech is a business technology company, and what we've done is set up a bunch of patient-centric data platforms. At a high level, they are patient platforms that are curated to put the patient first within their healthcare space. They can learn different uses of cannabis through our interactive tools. They can talk to a physician. They can read articles, go through our education content. That is, at the surface level, what the cannabis education platform is. Beneath the surface, we are pioneers in the data analytics part of cannabis space. What we try to do is make everybody's next interaction based upon their previous. So knowing the different categories of what you're learning, knowing the different click-throughs that you have on your CRM emails, we will then base the next curation of content based on user behavior traits to make sure that there's constant engagement throughout the platform. It's a pretty wide gap. So we have people that are just getting into the space, people that have been in the space for 20, 30, 40 years, but at the center of that, education is prime. Everybody needs to learn a little bit more about what it means to go on different strains, different methods of ingestion, what they should talk about with their doctor, can they legally take it on their travels, how can they continue their healthcare through cannabis, and that is what the Cannvas.me platform is all about, is education first for the patient. I think that's one of the biggest opportunities for Cannabis MedTech, is really playing on the cannabis data space. So learning about different behavior traits, learning about what the industry is doing, what it's not doing, the different likes and needs and wants of the patient, and also the adult use market. Honing in on what those next key elements are and serving that back to the community, providing insightful reports, working with different academic communities, working with physicians, clinics, Health Canada to kind of put it out there of this is what the landscape of the cannabis market looks like, and here's the data to actually back it up. And we feel that that is a crucial gap that is not being filled right now, and one of the main elements of Cannabis MedTech. I think we've already reached into that space with a lot of people giving CBD oil, hemp-infused products to their pets, but it's very similar to the adult market where people were already start using before being fully educated. So that's what we're providing to the pet community as well, is education based on whether they have a bird, a lizard, a cat, a dog, if they're a 100-pound dog versus a 50-pound dog, if they're 5 years old or 15 years old, what are the best ways or conversation pieces that they need to have with their vet if they wanted to infuse cannabis for the health care of their pet. So we're launching that education platform for your furry friend. The long-term plans is to be the household name of cannabis education, and there's a few ways that we're doing that. We're integrating through our white labeling solution, Cannabis Health, getting into pharmacies, clinics, healthcare communities. We're even trying to get into palliative care units within hospitals, really extending ourselves on that education piece within the different elements globally, not just within Canada. So getting our name out there and getting into the brick and mortar space, getting into the digital space of different clinics, and really extending that education piece. So on the horizon is just more and more global expansion for Cannabis MedTech.